Can you put a price on human life? My name is Nancy Pickett, and I'm a student filmmaker. I also happen to have Ehlers-Danlos syndrome, dysautonomia, and digestive tract paralysis, so I rely on a feeding tube and central line for most of my nutrition, hydration, and medications. I have 7 doctors in 4 different healthcare systems, and there's no cure for my conditions right now, so I'll probably be like this for the rest of my life. Before the Affordable Care Act was passed, as that number got bigger and bigger, I'd get closer to my annual cap on benefits, and after I reached that number, my insurance wouldn't have to pay for anything else the rest of the year. The next year, even if my coverage reset, I'd probably end up reaching my lifetime limit on benefits, and at that point my insurance company could deny me coverage ever again just because they'd already spent a certain amount of money on my health care. The ACA kind of reversed the system, this time to benefit patient care. They got rid of the annual and lifetime cap on benefits, and they instated what was called a maximum out-of-pocket expenditures, so that families like mine wouldn't go bankrupt from paying all these bills that came from the overly inflated healthcare system.
I get letters every single day from people who say, this has saved my life, or this has saved my bank account.
As we all know, the ACA is a delicate balance. President-elect Trump even expressed support for the 3 most popular parts of the law: pre-existing conditions, allowing young people to stay on their parents' insurance until age 26, equal treatment for women. But Republicans will soon learn that you can't keep the good parts of the ACA and remove the rest of the law and still have it work.
When it's time to leave my parents' insurance, it's really important that not only am I ready and able to support myself, but also that I'm going to have the coverage that I need. If an insurance company was allowed to say that they're not going to cover my gastroparesis just because I was diagnosed at 15, that would leave me paying out of pocket for my feeding tube, my central line, my TPN, most of my meds, and it would really start to add up. Even if I went into liver failure from being on IV nutrition, they could still relate that back to gastroparesis, since that's the reason I was on TPN in the first place. I could get coverage for a mammogram to prevent breast cancer, but I couldn't get coverage from the disease that I'm actually suffering from.
So we're going to repeal Obamacare. We're going to replace it with something that's going to be terrific.
If someone wants to accuse me of doing everything I can to stop this terrible Affordable Care Act in its tracks, absolutely.
First, we agreed to repeal the Affordable Care Act because it's not working for the American people.
We're going to have a health care that is far less expensive and far better.
We're completely in sync, planning on a daily basis with the administration.
You're going to be very proud of what we put forth having to do with health care.
How does it sit with you and your constituents that Republicans in Congress are racing to repeal Obamacare without a replacement, and the fact that they haven't been able to come up with a replacement for more than 6 years?
Without Obamacare, millions of people will be without coverage again, and if they're chronically ill like me, they can't afford to be without insurance for any period of time, let alone how long it's going to take Republicans to create new replacement legislature. I just traveled to Miami for a specialist appointment that I waited 7 months for, and that's kind of the deal with most rare disease specialists. Like, you have to wait and get on a waiting list. If you cancel an appointment like that due to not having coverage, you're going to double your wait time, and some people can't afford to do that.
Think of it like you're shopping for prom. You might find the perfect dress, but if they don't have your size and your prom is tomorrow, you can't get this dress. You have to settle for a dress you kind of like, but it's not as good as this one. The Affordable Care Act is like the dress you settle for. It definitely has its problems, but you can't afford to wait for the perfect one.
You can do that by the following. One is to allow people to buy insurance across the state line. It's Marsha Blackburn's bill. 2, allow people to have an association health plan. Number 3, massively expand health savings accounts. Our group started with health savings accounts when they first became available. I still have one. It puts the consumer in charge of their health care.
The proposed solution to replace Obamacare with HSAs and an open private insurance market would be totally detrimental to low-income and chronically ill families. Because a health savings account isn't even coverage. It's just a tax-free way of putting aside money that you want to use towards your medical expenses. If you're living paycheck to paycheck, you're not going to have money to put in your HSA. Even if you did end up saving a couple $1,000s, that could all be wiped out in one hospital stay, even if you had an affordable private insurance.
The first big fight of this new Congress will be over health care. Republicans are plotting, and soon will be executing, a full-scale assault on the three pillars that support the American health care system: the Affordable Care Act, Medicare, and Medicaid. The Republican plan to cut health care wouldn't make America great again, it would make America sick again. They have no idea what to put in place of the Affordable Care Act. For years they've talked about repeal, but for 5 years now they have had nothing to put in its place.
Once you put an expiration date on the law, will actually cause some insurers to flee the market. And CBO's report put a number on that, said that in 2018, 10% of the country would have not a single insurer.
Do you believe that health care is a right of all Americans, whether they're rich or they're poor? Should people, because they are Americans, be able to go to the doctor when they need to?
I look forward to working with you to make certain that every single American has access to the highest quality care and coverage that is possible.
Has access to does not mean that they are guaranteed health care. I have access to buying a $10 million home. I don't have the money to do that.
I've made it through a lot, but losing the Affordable Care Act isn't something I'll be able to recover from.